This slide is showing the features of the melanoma of the skin. To diagnose correctly and treat properly, and to confirm the final diagnosis, you will look for asymmetry of the lesion, border of the lesion, color of the lesion, and diameter of the lesion. The acronym becomes ABCD. A for asymmetry. In this part, you are looking at the features of melanoma of the skin. Look here, A, B, C, and D. This is the lesion. I am outlining it broadly. Okay. A means asymmetric. The two halves of the mole looks different. If you divide either by this way or by this way, there will be no symmetry. So this is one of the feature of malignancy.